Okay, so Bache, this gets us to our next topic or next chapter in general pathology. That is, let us start with inflammation. This is your first main topic in general path. Because cell injury, it was easier. It was much easier. Though questions come from that, but वो काफी easy था. So this starts us. This is where we actually start with pathology, general path. That is, let us start with inflammation. Now, now suppose any particular area is inflamed. So there are four main words associated with inflammation, which are rubor, tumor, rubor, tumor, calor, and dolor. These are the four words associated with inflammation. That is redness, swelling, heat, and pain. These are the four words associated with inflammation. If any particular area is inflamed, it will be red. There will be a swelling. It will be heated. वो बाकी area से थोड़ा गर्म होगा and it will be painful in nature. These four words of inflammation, they were given by Celsus. These four words, they were given by Celsus. Next point, please put a star. The next word, that is functio lucio. The next word associated with inflammation, that is functio lucio, or loss of function. Functio lucio or loss of function. Loss of function was added by Rudolf Virchow. The next word, that is functio lucio or loss of function, was added by Rudolf Virchow. Next point, a very, very basic slide. Next point. So this is where we start with our first small topic in inflammation, that is components of inflammation. पहले वाले से शुरू करते हैं, that is let us start with components, starting with components of inflammation. Inflammation, which it has three components. There are three main components of inflammation, that is vasodilation. It has three components, that is vasodilation. Inflammation with the blood vessel dilates, which is associated with increased permeability of the vessel wall, which in turn leads to increased permeability of the vessel wall, in turn leading to emigration of leukocytes from the circulation. In turn leading to emigration of leukocytes, from the circulation. These are the components of inflammation. कुछ भी नहीं है, सीधी सी चीज है. Blood vessel dilates, vasodilation. Permeability of the vessel wall increases, increased permeability of the vessel wall, and leukocytes which are flowing in the blood vessel, they come outside the blood vessel. Emigration of leukocytes from the circulation. First point, what is the first change? Seen in blood vessels? Vasoconstriction or vasodilatation? What is the first change? Vasoconstriction. The first change seen in blood vessels in inflammation is vasoconstriction. सबसे पहले vessel constrict होती है. Vasoconstriction, which is transient in nature, that is, it is for some time only, which is transient in nature, followed by vasodilation. So the first change seen in blood vessels is vasoconstriction, which is transient, which is for some time only, followed by vasodilation. This in turn leads to increased permeability of the vessel wall, followed by emigration of leukocytes from the circulation. When leukocytes come outside the circulation, what is this process called as? This is called as diabetes. Emigration of leukocytes from the circulation. This is called as diabetes. Mediated by diabetes, which is mediated by CD31. Or PCAM. PCAM stands for platelet endothelial. Which stands for platelet endothelial cell adhesion molecule. Diabetes, it is mediated by CD31 or PCAM, that is platelet endothelial cell adhesion molecule. Next point. So there were three components of inflammation: vasodilation, increased permeability, and diabetes. So this gets us to our main component, that is increased permeability. Increased